If you have ADHD and you've been prescribed Adderall or are just considering it for yourself or your family member, you probably already know it's one of the most well-known and commonly prescribed medications for ADHD. But here's the thing a lot of people miss. Adderall is not just one medication. It comes in multiple forms, including immediate release and extended release. Same active ingredients, but very different in how they work, how long they last, how efficacious they are, and how they feel in the body. So today, I'm diving into the real-world experience of Adderall, what it does, what to expect, and how to know if it's the right fit. Let's get into it. I'm Dr. David Danish, a double board certified psychiatrist that specializes in treating ADHD. Adderall is a combination of 4 different amphetamine salts, 2 forms of dextroamphetamine and 2 forms of levoamphetamine. That blend gives it a balanced stimulant effect, boosting attention, motivation, and mental energy by increasing levels of dopamine and norepinephrine in the brain. Both the immediate release and extended release versions work the same way chemically, but they're delivered to the body in very different ways. Immediate release Adderall kicks in fast and usually lasts anywhere from 4 to 6 hours for most people. That's why it often needs to be taken 2 and sometimes even 3 times per day. Adderall extended release, or Adderall XR, on the other hand, uses something called dual bead technology. Half the dose is released right away, almost like an immediate release, and the rest is released about 4 hours later. This gives you a much longer window, typically 8 to 12 hours, with just 1 dose in the morning. That makes XR a great option for students, working adults, or anyone who needs all-day support without having to remember multiple doses. Unlike sister medications like Vyvanse, which is a prodrug that has to be metabolized before it starts working, Adderall is active immediately. That means a faster onset, usually within 30 minutes, and a stronger initial effect. As effective as Adderall can be, it's not always smooth sailing. It has unique side effects that need to be discussed. Let's walk through what to watch for, starting with the most common side effects. First up, the stuff that I see quite a bit, but it's manageable. The most frequently reported side effect is appetite suppression, happening in about half of the patients who are on it. For children, that often shows up as skipping lunch or eating less at dinner. This is something we need to watch closely because weight loss is a common problem, and sometimes if the weight loss is significant enough, it can lead to delays in growth over time as well. Usually when the medication wears off in the evening, those patients are significantly hungrier at that point and sometimes can make up for the food that was missed during the day. Other common side effects include trouble falling or staying asleep at night. Again, with the immediate release, that's less likely. Headaches when they start the medicine or when the medicine wears off. Dry mouth, mild stomach upset, which is benefited by taking it with food. If the dose is too high or it's not the right fit, some patients feel jittery or irritable or too revved up. Now, most of these effects do improve after the first 1 to 2 weeks, but if they're too intense or too persistent, your prescriber may adjust your dose down or switch to a different medication altogether. Next, the rare but important risk to know about Adderall and stimulants in general. Adderall is generally safe for most people, but because it stimulates the central nervous system, we do want to be thoughtful, especially with heart health. Before starting, your provider should ask about any family history of sudden cardiac death, or arrhythmias that occur in close family members or the patient themselves, any chest pain, or any other cardiac risk factors. Now, if those don't exist before starting the medicine, that's great. If they start to occur after starting the medicine, then stop it immediately and let your provider know. In cases where there is that family history of heart concern or cardiac concerns, an EKG or ECG, electrocardiogram, is recommended to rule out any hidden heart risk prior to starting this medication. Then there are the mental health considerations. Stimulants can sometimes trigger or worsen anxiety, especially in people who are already prone to it. This is confusing because in some of those patients with ADHD and anxiety, stimulants treat the anxiety. So a lot of times it's something that needs to be trialed. We can't know ahead of time. Similarly, if someone has bipolar disorder, stimulants can unmask or trigger mania if the stimulant is not paired with a mood stabilizer at the same time. That said, the research does point towards stimulants being very safe in bipolar disorder as long as the bipolar disorder is managed with a mood stabilizer. And lastly, and not least important at all, the potential for misuse or abuse. Because of Adderall immediate release, having a fast onset and short duration, it is one of the highest and most abused stimulants in the stimulant class. This should not be used for someone who has a history of stimulant abuse. The extended release preparations tend to do better, but I would even recommend using something like Vyvanse, a non-Adderall extended release, if someone has a history of abusing stimulants. Even then, I might not prescribe an actual stimulant. That is all case dependent. In those who are at risk of abuse because of age or circumstance, the provider should check in with them regularly and monitor for overuse or for sharing of the prescription. And one last point about that. Study after study shows that if you properly treat ADHD with stimulants, the risk of substance abuse in general, whether it's with stimulants or other types of illicit drugs, goes down quite a bit. In other words, there is no legitimate research showing that treating ADHD that is properly diagnosed with a stimulant leads to an increase in addiction in any way. I typically use Adderall for my pediatric and college-age patients when they've tried methylphenidate-based medications already and they didn't do so well, such as Concerta or Ritalin. Focalin is another example. In those children and young adults, if that methylphenidate compound was not strong enough, then oftentimes amphetamines such as Adderall extended release or Vyvanse do the trick. I tend to reach for Vyvanse over Adderall extended release in most cases initially, but in some patients, they just tend to prefer the feeling on Adderall extended release because of that initial increase in efficacy early in the morning that Vyvanse doesn't have for some people. Adderall does tend to be a little bit more activating than Vyvanse or something called Adzenys, and for some people, that's too much. They get anxious or overfocused or just jittery. When that happens, we pivot quickly. Usually, one dose of Adderall extended release in the morning is enough, but not always. It doesn't last quite as long as Vyvanse or something called Misuse, so sometimes I'll add a small dose of immediate release Adderall in the late afternoon to smooth things out for my patients who need to do afternoon or evening homework, or for my patients who might be too emotionally reactive in the evening after school when the Adderall is not in their system. I always tell my patients, Adderall is a powerful tool, but it has to be tailored. Think of it like adjusting the volume on your headphones. Too soft and it's not doing anything. Too loud and it's overwhelming. The right fit, the right dose makes all the difference. More is not always better. If you're starting a stimulant like Adderall or figuring out whether IR, immediate release, or extended release is the better match, know that you don't have to figure it out alone. To go deeper, check out the Mind Vault on my website, drdaviddanish.com. It's completely free and it includes a full walkthrough of every stimulant side effect to watch out for, what is common, what's not, and when to call your prescriber. It also includes special and important details about when you should consider an electrocardiogram before starting a stimulant. Thank you for watching, and as always, if you found this helpful, please give it a like or share it with someone who might need it. You've got a lot of options, and I'm here to help you find the right one.